younger than 5 years old could soon be eligible for a COVID vaccine.
Pfizer asked the FDA for that emergency use authorization. And this morning, we're going to take a closer look at the impact on local families. CBS 8's Chris Groh joining us live outside Rady Children's Hospital. It's a decision many parents now have to make. And what are physicians saying about it? Good morning to you, Chris.
Good morning. And physicians say, at least the one that we spoke with, that the vaccine benefits outweigh any potential side effects, and that this age group actually shows less side effects than older children. And still, though, we are seeing some hesitancy from some parents, and other parents are likely to get the vaccine for their child right away. Take a listen.
I feel just devastated and feel so responsible for it being my fault, and that mom guilt is real.
And that was a mother of a young 2-year-old who, again, has a husband who's immunocompromised and would not really want to see potentially their 2-year-old get their husband sick. And so they're looking forward to getting this vaccine. Now, Pfizer has asked the FDA for emergency use authorization. It is a 2-dose vaccine for children ages 6 months to 5 years old. It's not the same dosage as what adults received. In fact, it's 1/10 of what adults receive. But when all is said and done with the emergency use process, this vaccine could be available by the end of the month or the start of March for that age group. Now, according to a survey from the Kaiser Family Foundation, 31% of parents will get their child vaccinated right away. That's up from 20% in July. CBS 8 spoke with Rady Children's doctor and FDA vaccine advisory panelist Dr. Mark Sawyer about this development, and he says again, it is a much safer bet based on science and the data to get the vaccine than it is to risk COVID.
We have so much experience immunizing babies, starting at birth and certainly at 2, 4, and 6 months of age. Pediatricians appreciate the value of the vaccine, and when they do the calculation of the risk of the vaccine versus the risk of the disease, you decide to use the vaccine because it prevents many more problems than it causes.
And for more information on the emergency use authorization process and to get an idea of where you can get your toddler vaccinated if and when it does receive that authorization, you can go to our website, cbs8.com, and click on that story link.